Wine and Wisdom is the annual educational event of the MIQS Council, and our goal is to share patient safety education with the community, mostly with healthcare professionals.
Medical errors are the kind of thing that people don't often talk about, and so to have an event that brings people together to bring it to the surface and to make people aware and a little bit more conscious of what they're doing is really important.
I see Wine and Wisdom being just one example of the many things residents are doing across the country. There are other examples at programs where residents have come to one of our summer camps in patient safety and gone back to their home institute and are doing similar type of programs where they're making the difference in healthcare.
I don't think I would have been involved in any of the patient safety activities that I'm currently engaged in if it weren't for the Telluride experience.
The Academy for Emerging Leaders really allowed me as a faculty and a teacher to learn skills to be able to train these clinicians of tomorrow in patient safety, which is something that the aviation industry does commonly, is that they train people together, whereas in healthcare we're still learning and navigating how to do that.
I think if the physicians understand the importance of patient safety and the quality of care, I think across the board patients will obviously be that much better off, and as many young physicians as we can reach and get that message to them, the more patients that will have to suffer any adverse event or any harm.
Oh, there's no question that residents who attend the Academy for Emerging Leaders are learning about patient safety, and not only that, many are proactive in doing things in their home institutions to make care safer. There's some incredible stories of their leadership. And having a community of residents come together, you're starting a movement here. And keeping that movement going, that's the strength of it, and that gives me hope.
My job is taking care of events when they don't go so well, the risk manager. So things come to my office when there isn't a good outcome. The more that our physicians, nurses, and others learn how to keep patients safe, then the fewer of those events that come to my attention. And quite frankly, I'm a guy that would like to be put out of a job. I'd love it if they could take me out, but take me out the right way.
I would just encourage other physicians, nurses, medical students, nursing students to really empower themselves to commit to education and patient safety. It seems intuitive, and it seems like something that will just come with your medical education, but you really do have to seek out the educational opportunities, and that's what the MIQS Council, Wine and Wisdom, and the Telluride experience really try to cover.